Well, good morning and welcome to the Great Transition Senior Living Seminar Series. Today we're going to be tackling the topic of living with dementia and Alzheimer's. Great Transitions was founded back in 2013 by Paul and Lynn Henderson to guide seniors during one of life's biggest transitions. It's a system for working with seniors and their families as their lifestyle and housing needs change. Now, we talked earlier about how it can be 3 to 6 months, or it could be 12 to 18 months, or maybe even longer before someone is ready to make a move, or an event or a diagnosis can expedite that process. And we're here to guide you through whatever that process looks like for you. We genuinely believe that helping and guiding seniors is our greatest responsibility, and it's an honor and privilege to care for and help those that have guided and cared for us for so many years. That's the Great Transitions way. Our objective here today, and every time we meet for the seminar series, is to educate people on legal, financial, medical, housing, general items of importance to seniors. We are not here to try and sell you anything. We're here to provide education. Our educational partners are in the room because they feel that way as well. But we all have a couple of challenges for you to walk away with and continue to think about after the seminar today. Number one, who will be tasked with making decisions for you when you are no longer able to do so for yourself? And will you agree with the decisions that they make? And very importantly, have you shared your plan with your trusted advisors or loved ones? So with that said, we're going to talk about a topic that some people don't find very pleasant, but something that we definitely need to talk about more often. We must make every effort to have the topic of dementia and Alzheimer's become acceptable conversation. So many people don't want to talk about it. I was talking with a couple recently, and one of them was experiencing what appeared to be some cognitive impairment, and I suggested maybe it's time to get tested. And so one spouse said, "How do I tell the other spouse that?" And I'm like, it's part of what normal healthcare should look like now. We're living longer, and we need to have our brains checked, just like we need to have colonoscopies and all the other exams, vision exams, eye exams, or vision exams, hearing exams, all of those things. It's estimated that 6.9 Americans age 65 or older are living with Alzheimer's right now, with 73% of those people being age 75 or older. And by 2050, this number could grow to over 12 million people living with Alzheimer's. And it's not only the patient, but the caregiver that dementia can take a big toll on. When compared to caregivers of people without dementia, twice as many caregivers of those with dementia indicate substantial emotional, financial, and physical difficulties. So it's a heavy topic, but one we're going to dive into today. And I encourage you to talk about it more in your circles, with your family. In fact, we could probably spend a couple of days talking about this topic today, but we're going to take the Cliff Notes version and kind of hit the high points. You'll have some questions that are specific to you and your situation, most likely, or someone that you know. Jot those down. We'll have a chance to discuss them at the end of the presentation. And with that said, I'd like to introduce you to our panelists today. Dr. Anand Patel is a board-certified anesthesiologist with a subspecialty certification in pain medicine. Dr. Patel, Winter Park's own, graduated from University of Florida College of Medicine and completed his residency and fellowship at New York Presbyterian Cornell. He subsequently worked as an interventional pain physician at the Center for Pain Medicine in Orlando for 10 years. Dr. Patel joined Conquest Research in 2018 and has served as both PI and sub-investigator on more than 100 studies across various therapeutic areas, including orthopedics, pain management, migraines, rheumatologic disorders, neurodegenerative disorders, MASH, and general medicine studies. He has authored multiple publications related to his work as an investigator. Diane Burns is a licensed clinical social worker focusing on older adult issues. She worked with the Advent Health Geriatric Medicine Fellowship for a decade, assisting patients and their families in navigating the complex medical and psychosocial issues of aging. With the Alzheimer's and Dementia Resource Center, she has launched a support group for people newly diagnosed with dementia or mild cognitive impairment. And for the Alzheimer's Association, she has facilitated a caregiver support group for more than 12 years. Welcome, Dr. Patel and Diane. We're glad to have you both with us today. Glad to be here. So with that, we're going to jump into some questions. And let's maybe start with some definitions. The words dementia and Alzheimer's, we use them simultaneously. Dr. Patel, could you clarify for us the differences and share the prevalences of the various types?
Yeah, absolutely. So it is true, those words tend to get used interchangeably, and even medical providers sometimes use them interchangeably. When we think of the word dementia, think of that as like an umbrella term. It just captures any disease process where your memory is having a difficult time with memory, with thinking, and other related skills. And then there are different types of dementias, the most common type being Alzheimer's disease. I would say that affects approximately 60 to 80% of patients with dementia have Alzheimer's. And then there's less frequent types of dementia. The next most common one would be vascular dementia. And then there's a more, even less frequent, it's called Lewy body dementia. And then a very rare dementia is called frontotemporal dementia. That's maybe 1% of the time. So commonly, that's why they get used so interchangeably, is because Alzheimer's is the most prevalent type of dementia.
Gotcha. So, understanding the definitions a little bit better, what would some early symptoms be that might indicate the need for an evaluation, and what should someone expect at that evaluation?
Yeah, that's a good question. So I would say the hallmark symptom is going to be a steady progressive decline in memory. So you would expect, and specifically short-term memory. That's really like the underlying disease mechanism that sticks out the most. So things that are commonly cited by patients are difficulty with remembering tasks recently completed, repeating the same questions or stories over and over, but it can even be things like losing orientation to time or place, difficulty navigating streets that were previously familiar, forgetting how to do previous tasks that you were previously very familiar with. So all those things can kind of stick out as some real life situations where I can come up here.
Okay. And as far as an evaluation, how does that lay out?
Yeah, so if you go through, let's say, you recognize or you worry these symptoms are starting to show up, you may go to like your primary care doctor. Typically in that scenario, your doctor may explore what kind of symptoms you're specifically experiencing. And based on the discussion, he may say, you need further evaluation. That might be cognitive testing. Or he may send you to a specialist like a neurologist, and they may kind of work it further with potentially imaging, etc. And then there's a possibility that they may start you on some sort of treatment, symptomatic treatment or symptom-focused treatment to see if they can mitigate or reduce some of the symptoms.
Okay, great. So we looked at a little bit of the medical side. I want to jump over, Diane, and talk about more of the emotional side. So physical, emotional, spiritual, mind, body, emotion, what kind of challenges is someone with that diagnosis going to be looking at?
Well, I think that as Dr. Patel said, the early symptoms are memory loss and also the difficulty sometimes with completing the more complex tasks that we are used to doing in our everyday life. So initially, a person may feel frustration and just be kind of consternation that things that they've always been able to do successfully are now becoming more difficult. That could include things like filing taxes, like operating a computer. Sometimes even smartphones become a challenge for folks who previously didn't have any trouble with operating them. So all of those things bring to the fore for the person experiencing them, fears and loss of autonomy that can be very, disheartening, let's say. So I think that's where the initial challenges often are. And of course, before they have the diagnosis, a lot of the fear may be revolving around the unknown nature of this and fear of what it might be. Getting the diagnosis has its own ramifications, and I want to go into that in a little bit more detail. But there is the possibility that actually getting the diagnosis may have caused some relief if people have been frightened by the fact that this is going on and what does it entail, to actually find out, okay, this is what's going on and I now have some avenues to pursue for treatment. As far as the emotional challenges of a diagnosis or being in the early stages of the disease, they're really very similar to a diagnosis with any sort of serious illness. And those can follow by having a sense of disbelief or denial for some people, a fear of what might come in the future, also fear of moments of confusion, fear of embarrassment by not being able to remember something that you want to remember when you're in a public setting or with friends. There are also, people may experience anger, kind of a why me, some anticipatory grief and loss about what the disease might mean going forward, about things that they had planned to do in later life that might not be available to them. Some folks will experience a crisis of faith, a questioning of their faith and asking if God has abandoned them. And that can be particularly difficult. There's also sometimes a loss of purpose, a sort of feeling that if I'm not able to do the things I've always done, who am I? So that can be a challenge. Successful adaptation to any kind of illness is kind of working through some of those issues, some of those emotions. Not everybody experiences all of them. Some people just experience one or two. In the support group that I'm facilitating, we find that people have very different reactions to the diagnosis, from the mentioned relief, now I know what I'm dealing with and I can address it, to one member of the group was kind of just stuck in this anger phase and for several months, but now has feelings that she was able to resolve that and can now kind of just grasp life in a new stage and get on with it and enjoying what's offered in that life in a new stage. I think one of the particular challenges of any kind of dementia is that even though we may work through emotions and come to a place of acceptance, that may be temporary because the brain changes the dementia brings will change the sense of self as there is progress in the disease.
Okay. So it sounds like it's super important to be connected with a group or a support team of some sort as you begin to navigate the diagnosis.
Yeah, as Beth said earlier, I think communication is our best defense for dealing with emotional challenges. So it's unfortunate that in a lot of cases, people will be in denial and they kind of freeze up and they don't want to tell anybody. And some folks will work really hard to cover the lapses that they are seeing in themselves. I feel that really makes it very hard for them as well as all of the family members who are dealing with them. So open communication, being able to talk openly with the people who are closest to you, and then if you have a partner, if you have a son or daughter, if you have whoever is that closest person that you can communicate with And then as that becomes comfortable, then the two or more of you in your family can decide how do we share this information with our wider group of friends and associates.
Okay, great. So that is taking the tact of looking at the person that has received the diagnosis, but the caregiver is going to be impacted, mind, body, emotions, all of those things as well, right?
Yeah.
Let's take a look at the caregiver and what we might keep in mind where that's concerned.
I think that caregivers have a superhuman challenge because they are not only trying to manage their own emotional reaction to their partner or parent who is diagnosed, and that may include grief and loss about their future together, and they're also trying to make a transition in many cases from being a spouse or being an adult child to kind of walk over the bridge to become a care partner. And that can be very challenging. I find that it is challenging in different ways for spouses and for adult children. So at the same time they're managing this for themselves, they are also trying, in the best case scenario, to help their person with dementia manage their emotions and find their way to some peace about the diagnosis. So they really have a double challenge, helping themselves, helping their loved one. And so that there are some strategies that I think caregivers can successfully employ to help manage their own emotions, and this is one of them. Education about the illness, knowing more about it is often helpful. Learning also coping skills and also learning what the resources are for help. And we happen to live in a community that is rich with resources, so we can be thankful for that. Joining a support group of other caregivers is very helpful for a lot of people. It allows ventilation of feelings that they may not want to express with their loved one, or even other family members. It is an open and safe place to express whatever the emotions are. In addition, it's not just about venting. Support groups are not just about venting. There's an enormous amount of sharing of, if this doesn't work for you, try this, it worked for me, coping skills, and also sharing information about resources of all kinds, from the ones that you see on the back of your notes page to particular physicians that people have found to be helpful, to what research projects people are involved in. And so there's just a lot of sharing of information in support groups too. Finally, I think that that maybe the more challenging duty or purpose for a caregiver is developing a plan, and that means getting the pieces in place that are going to be supporting you in your efforts as time goes forward. And I like to say you need a plan and you need a posse. You need a posse of helpers. No one successfully does caregiving alone. And that posse can involve anybody from, the person next door that you're close to who will be able to run over and help you with something, or stay with your loved one while you make a dash to the store or the doctor or what have you, to organizations in your community that offer and provide support.
That's awesome. I have a good friend that always says your greatest superpower is the ability to ask for help.
Absolutely.
And developing that plan and having the support group is awesome. We moved a gentleman last fall to Waterman Village. His wife had passed away from Alzheimer's about 15 years ago, I think, and he was still involved leading a support group for men whose wives had been diagnosed. And that was his purpose. He had found purpose in that and a lot of healing as he progressed through the disease with his wife, and then to support other men that were going through it. So I think it is great to know that we have ADRC and other organizations that provide a lot of good support here in our Orlando community.
And not only caregivers can find purpose in advocacy, let's say, and helping other caregivers, but that is true also of people diagnosed with dementia. One of the organizations that I learned about that is really impressive is the Dementia Action Alliance. It's a national nonprofit. They have a fabulous website. And they are an organization that is distinguished by having an equal number of people on their board and in their leadership roles who are living with dementia. And they recently have developed and released a manual for well-being for living with dementia. It's downloadable free from their website, or you can order it in a print version, which has become kind of my Bible with my support group for people with dementia. It's a wonderful document. It's very helpful.
Awesome. So let's move on. Symptoms progress from mild cognitive impairment to moderate and then to severe, and there's really no certain time frame on any of that. What should people be sure to address early in the disease process? Dr. Patel, I'd like to take it from a medical standpoint, and I think, Diane, we've touched on some of it from an emotional, but maybe if there's anything else you can add, that would be great.
Yeah, I would say the first most important thing is to establish a care team, basically led by a physician. Commonly that would be your primary care doctor or a geriatrician or a neurologist, but really just having a team that's established and in place to oversee oversight of your care. I think it's reasonable to discuss treatment options with that provider or the care team. And I think that if they feel it's necessary, then they may kind of send you on to a specialist as well to further explore treatments. So that's, I think, probably the most important from a medical standpoint.
Okay. Diane?
Well, I think that it's really important early in this, after the diagnosis, to make sure that all the appropriate paperwork is in place for power of attorney, healthcare surrogate, and HIPAA releases for the person that you're closest to, and a backup person. So if I were with an early diagnosis of dementia, I would want to make sure that not only my husband but my son were on the HIPAA releases for my primary physician, any neurologist I'm seeing, basically all of your healthcare providers, so that there can be open communication with the doctors, between the doctors and the families. So important. And then, of course, the power of attorney and the living will are very important documents. And because, as Beth says, we don't know how fast different dementias will progress, or on an individual basis. The first thing you want to get out of the way. And I know families find these things often difficult to discuss. So maybe it is helpful to bring it up in the presence of your physician, or if you're reaching out to a group like ADRC, there are folks there who can help coach you with that process. So getting the documents in place, really important, will make everything so much smoother as time goes on. And then I think it's really important for the person diagnosed and their closest family members to have a discussion about how does this person want to spend their time that they have, where they'll be able to be participatory. Maybe early retirement is in order. Maybe there are bucket list trips that you've been putting off that need to be moved up. Have an open discussion with your family about, my priorities are changing now that I realize I'm dealing with this, and I need to have you on the same page with me. And then finally, I think a discussion with your closest family and a financial advisor about the family finances and how do we best set these up to meet the challenges that we might need for care as time goes on.
And we're really blessed to have our educational partners skilled in those areas. We have an elder law attorney that partners with us. She couldn't be here today. Evershore Financial, and Conquest and ADRC to help with all of those as well. So, Dr. Patel, you referenced a treatment plan. Are there different treatments for different types of dementia?
So I would think of it as, when I think of treatment, I'm specifically referring to medications. The reality is that the quantity of medications that we have available to treat Alzheimer's is still fairly small, which is kind of why we're fighting this battle to continue to search for new treatment options. But certain dementias have a tendency to respond better to those medications than others. So for example, when you look at Alzheimer's disease or Lewy body dementia, those have a tendency to be a little bit more responsive. And then when you look at other types of dementias like vascular dementia or frontotemporal dementia, those tend to be less responsive to medications. But I think in addition to medications, there's a lot of other things that can be done to help with treatment. So, they have obviously the core principles of getting lots of exercise, staying socially active, eating well, sleeping well. Those are probably really important in terms of management of the disease. And then there's cognitive stimulation therapy that can be done, cognitive behavioral therapy, where you're trying to activate the parts of your brain that are working and strong to help facilitate or overlap with the parts that are not working as well. So it's probably best as a multi-pronged strategy to address it.
Okay, love that. I know we had Dr. Agard here last year talking about some research and things like that. Are there currently anything thought to prevent or delay the onset of dementia?
Yeah, good question. So I think I alluded to that a little bit before. So staying active, and that doesn't mean just yourself physically, but staying engaged with the community, staying engaged with your family, staying engaged with your support system is really very important. I think diet, lifestyle, all really matters significantly in terms of prevention and delay of progression of disease. And then I think you obviously want to keep all of your medical history, like whatever medical diseases you have, pretty well controlled. And that's probably a really big part of it. And then I think also just being really proactive about memory health and just pursuing memory assessments in a regular fashion.
So getting tested.
Correct.
Okay, gotcha. We all watch TV from time to time, read the newspapers. Is there anything being marketed to people that's known by the medical profession or science to not work?
Yeah, I would say, generally speaking, anything that you see on TV, anything that you hear about on the internet, or that you see on the shelves at CVS, are probably not in any way FDA approved or properly vetted. They're marketed sort of falsely as diet supplements. They come with guarantees like your memory restored in 2 weeks, things like that. That just, if you think about it, a good rule of thumb is if it seems too good to be true and it's not something that's lining up with something a reputed professional like a physician would say, that it probably isn't the real deal.
Okay, gotcha. All right, Diane, let's take a look at caregivers. We know that as the disease progresses, sometimes people get violent or verbally abusive. And that can be a real problem. What's the best way to handle verbal abuse, either coming at you as a caregiver or being directed to other people around the patient?
It's a really tough problem. It's when people are experiencing dementia and becoming either verbally abusive or aggressive, it's usually in response to a trigger. And so the best course of action for the caregiver is to try to figure out what the triggers are for your person with dementia. And there are regular biological triggers that can involve pain, illness, that the person may not be able to express adequately what's going on, so you gotta kind of do some detective work to figure that out. Hunger, thirst, or fatigue are often triggers. Sometimes as dementia becomes more progressed, people can experience hallucinations or delusions, and that can be a trigger. Medication changes sometimes will launch an aggressive or a verbally abusive bout. Overstimulation, just maybe it's been too busy a day and that brain that has its limits now is completely overwhelmed. And being in an unfamiliar setting or in a crowded setting can trigger things. Also, people with progressing dementia sometimes experience sensory changes. They see and hear and feel things differently than we do, and those things can trigger. They can be especially sensitive to sounds. One of the common things that has been observed is that sometimes perception is different, and a black area of a floor will be perceived as a hole rather than a black tile or whatever it is. So that can cause a fearful response. So just looking for the triggers and finding out how you can successfully address them, either by avoiding them or changing the scene, is a really good way to handle it. If there is an outburst and it can be so emotionally impactful to the caregiver that's really hard to handle. So certainly for the caregiver, nobody will fault the caregiver who needs to remove themselves from the situation for a few minutes, as long as there's a safe situation to leave the person in. But sometimes if you're at home, that may be the best solution is to walk into a different room, make a cup of tea, take a moment, breathe, and then go back, not to reason usually with the person, but to rather distract, redirect, and that's another way to handle verbal outbursts, especially if you're in a public place. To quickly distract and redirect is often the best way to go. If it's handy as a caregiver to have just kind of I like to think of it as a deck of cards of things that will capture the imagination of your loved one with dementia. So maybe they love ice cream. Maybe they like to go out to lunch. Maybe a walk in a park is something that they particularly like. And so if you're in the grocery store and there's for something provokes an outburst or a bout of aggression, hey, let's go find some chocolate chip ice cream, or whatever it is will capture their attention and help them get redirected to another. I think a separate kind of issue is the person who is a caregiver now, and unfortunately there may be a history of verbal or even physical abuse with the person being cared for. That's a little bit of a different situation, and it probably will require intervention. Always, if there's aggression and if there's verbal abuse, be sure to talk to the patient's physician about it. It may be necessary to introduce a medication that's calming, and certainly if you're faced with aggression and it's physical, don't hesitate to call 911 and get somebody on the scene who can help you handle the situation, particularly if you're alone, you don't have an ally there to help you address the situation.
So asking for help, again,
asking for help
is super important.
And it's really important if you make that call to 911 to tell the person that you're speaking with that you're dealing with somebody with dementia, and to also request a crisis intervention trained officer. More and more communities have specially trained officers who deal with mental health problems and dementia. So it is very helpful if you can get, it's really known as a CIT officer.
Good. Thank you. That's very helpful. Dr. Patel, how long might someone live with dementia? Does the lifespan vary with the different types?
Yeah, it essentially depends on what type of dementia you have. Probably a 3 to 11 year time frame is a safe bet for Alzheimer's, and it can vary with other types of dementia. The way to look at it is that that's certainly an average range, but we have certainly seen recurrently patients that live up to 20 more years after diagnosis of dementia. And so I think it's important to point out that certainly it may shorten lifespan a bit, but there's also an opportunity to really kind of focus on like what's really important and pursue that, and recognizing you have a degenerative rare disease. Yeah.
So because it progresses slowly, you can do those bucket lists.
Absolutely, and I think that's really important to kind of appreciate is that you can look at it as doom and gloom, or it can be like, I really have an opportunity to be as, quality time with my loved ones and really focus on things that are important to me.
Love that. Okay. How often should a dementia patient be reassessed? And if a loved one or caregiver sees symptoms worsening or new symptoms presenting, should they try and get them an appointment?
Yeah, I think the general rule of thumb that we're operating with is if you have a diagnosis of dementia, it's reasonable to get memory assessments done every 6 months. And that's a good cadence to have so that you can see sort of any small, subtle changes that are occurring. And then, absolutely, if there's an acute change in status or something's really different, and it's not sort of a slow decline, something's really obviously changed, absolutely, it's reasonable to make an appointment for memory assessment earlier.
I know I was talking to someone where a fall sped up the process a little bit, or maybe a medication change, something like that.
Yeah, and that's a great point. So, you have a diagnosis of dementia, but certainly other things can cause or impact memory function that are completely unrelated to the underlying disease process, like a fall or a medication change or a mood disorder. So it's important to really just get established and assessed at that time.
Okay.
Can I follow up? I have a question.
Absolutely, yeah.
What do you find that that a healthcare setback, such as any kind of surgery or a bad bout of COVID or something like that, often accelerates?
I think it certainly can. I think it more like it takes a larger impact in terms of their memory and or recovery. So I don't know if there's a direct correlation between disease onset or surgery and acceleration of dementia, but certainly I think there's a tougher time recovering.
Okay, so it affects the recovery period.
Yeah, and I just think recovering back to like their baseline in terms of their memory status.
Right. Okay. When people are no longer able to fully participate in the decision-making process, what type of advice do you have for caregivers? And I think you referenced that a little bit earlier in talking about getting a plan together and talking about what you want. And we asked the question, have you made your plan and have you communicated your plan to the people in your lives? But what about caregivers? What's some advice that you have there?
Well, I think that the first thing is to always try to include the person in decision making to the extent that they're able, and that will change over time. I don't think until the very late stages, I don't think it necessarily ever disappears. So it's important for their self-esteem and for their sense of self to give them the latitude to make the decisions that they're able to. Even if those are small things, like do you go to the park today or would you rather stay home? Should we watch this movie or that movie? But a caregiver, I think, also has to be sensitive to when a patient may be getting to the point where decision making is stressful. So that can be a factor too. So, just kind of watching for the cues is really important. And we're talking here about kind of the small everyday decisions. It may at that point be beyond their ability in the later stages to make great sweeping decisions about what the plan is or whether we can make a trip or not. But trying to include them in the everyday decisions is really important. Like I said, to the extent that they're able to without being stressed out about it. Oftentimes you'll hear caregivers say, well, I keep asking my husband, my wife, my parent, what they want for dinner, and they just don't seem to be able to tell me. Well, it may be that they're at a point where they really are unable to figure that out. So in that case, it may behoove you to give two choices, you know. We can either have a burger or we can have spaghetti tonight. You have a preference. And maybe at some point that even becomes difficult and you're just putting the meal in front. But whenever you can to allow them in on the decision-making process. Like we said before, early in the trajectory of disease, to get the plan in place, to understand. I think caregivers are have a lot of confidence when they feel like, I understand what my loved one wants, both how they want to spend their days and what kind of care they want at the end of life. So having those discussions early allows you as a caregiver a lot of confidence and feeling like you're doing the right thing for that person, the thing they would have wanted. And you may not be able to achieve doing everything they want, but you're doing the best you can to work toward that. The other thing I think is really important to establish is hopefully a kind of a ground floor understanding within the whole family of what mom, dad, or spouse wants, and to be on the same page. I think there's a lot of heartbreak involved when late in the process, and particularly in the end of life process, when different members of the family feel like they want different things to happen. Some may be wanting aggressive treatment for something, and others may feel, well, you know, mom didn't really want that. Mom said at this stage she wanted us to, you know, back off and let things take their course. So I think just coming to a common understanding as a family, we're on the same page with this. That is so comforting to caregivers, and hopefully it provides a measure of comfort also to the person with dementia to know that my family is behind me. They're doing what I wanted. Some families find this really difficult to achieve, and they might even a family meeting with the patient's physician is often really helpful in coming to a common understanding. But they may even want to meet with a family counselor to work through things.
Great. We talked a little bit earlier that on the back of their sheet there's some resources, and you referenced a national resource, but and you also talked about we have a great community here. So what are maybe your top 3 local resources that people can go to for more information, whether they receive the diagnosis or someone they care for has?
I think that Alzheimer's and Dementia Resource Center is a treasure, and they are available to help both caregivers and people living with dementia. And they have support groups, they have care coaching, they have educational programs for caregivers, and so I think that's a great place to start. And they are also really they have a whole array of resources to guide you to including the research organizations like Conquest that are doing clinical studies, and physicians that can help, neurologists. They have a whole bucket full of resources to help with. The Alzheimer's Association has a local chapter. Really, most of the Alzheimer's Association resources are online. They do have a great website with a lot of information for both persons with dementia and for caregivers. They do have a local chapter you can reach out to, but maybe the biggest thing to know about the Alzheimer's Association is that they have a 24/7 800 number that you can call any time of day, and they will help you with an urgent problem, and they will put you through to a licensed counselor if that's needed. So just know that that is out there. A resource that I really should have included in the list on the back page and didn't think of it until like 11 o'clock last night is Senior Resource Alliance. And they are the Central Florida clearinghouse for all sorts of services for seniors and for Medicaid funded services for seniors. So folks who are needing some assistance with caregiving at home, there are programs that the state and federal government help with if that's unaffordable for you. Senior Resource Alliance, if you Google them or look them up, that is a very good, also, they have a call center, they will field your request for resources and direct you in the right direction. There's a whole plethora of other resources that I think some of our education partners are representing today. One thing that we didn't mention yet is adult daycare, and there are a number of those available in our community that can be really helpful for folks, especially caregivers who need to work or just have other things they need to do, maybe medical issues of their own. And adult daycare helps to provide some mental stimulation. Then the other resources, really quick, the brain fitness and brain wellness programs that are on the list are really terrific half-day programs for people who are having memory and cognitive problems, but are still able to participate in a program of brain stimulating activities and social intercourse with other people. They're terrific programs.
Great, thank you. We are blessed to be living in a spot that does have a lot of options for us. Indeed. Dr. Patel, if someone has received a diagnosis, what's the best next step for them, and maybe for their caregiver and loved ones also?
Yeah, I think we touched on some of this earlier, but I think first and foremost, just establishing care with the provider would be a really good idea, to have someone directing oversight of your plan. And then I think complementary to that is just having a game plan in general. So, you're going to want to focus on some lifestyle modifications. You're going to want to focus on having routine and scheduled drive, your ability to maintain structure in your day. And I think that just connecting to resources that are in the community is a really important part of it as early as possible. I would say those are three of the biggest things I would push.
For a caregiver, should I go ahead and, if I'm a caregiver, do I need to go ahead and make sure my medical stuff is up to date so I'm healthy?
That's a fantastic question. Absolutely, yeah. So as I mentioned, caregiving is a double load, right? You're basically having to take care of yourself, make sure you're doing well, while at the same time maintaining oversight of your loved one. So, absolutely.
And I think we see that the caregiver's like, oh no, I can't go to my appointment because I have to take care of this person.
Yeah, it's like the analogy is when you're on the airplane and the oxygen mask stuff. That's like, why do they say put yours on first? Is because you're the one that needs to be kind of awake and getting oxygen so you can help other people. And similarly, you have to kind of service yourself in that sense and make sure you're well taken care of.
Along that same line, there's actually a book by that title by a eminent geriatrician who deals in dementia. It's called Take Your Oxygen First. Dr. Rosemary Laird is the author, and it's a great book for caregivers.
She's a local resource.
And she is.
So we addressed it at the beginning and talked about how this topic is one that many of us choose to recoil from. And today I think we have made some headway in making this acceptable conversation. Some thoughts on how we can take this further in this direction to better serve patients and caregivers.
Well, I was thinking about this last night, and I thought I have lived long enough to remember when a cancer diagnosis was a whispered diagnosis. People were so frightened of it that they didn't like to utter the word. People were diagnosed and kind of kept it to themselves, and the burden was all on them. And as you all know, that is radically changed over, I would say, the last 30 to 40 years, to where cancer is a huge cause. People are, I don't think, afraid to utter the word. There are enormous fundraising efforts, curative research. It's a cause célèbre. Different foundations for all kinds of different cancers, and I think this is a trajectory that we need to pursue with dementia, for both societal reasons, because there are a growing number of people dealing with it, and if we don't deal with it successfully as a society, then there are a lot of people who are affected. But also because I think the burden of dealing with it alone is very, very great. I have seen families where a spouse is diagnosed and the caregiver and doesn't want to tell anybody, and it's all on them. And it's often observed that caregivers sometimes die before the person they're caring for. The stress is so great that it leads to health complications for them, or like Beth said, they don't take care of themselves. Actually have an example of that in my family for an aunt who had Alzheimer's disease, and her husband was so devoted and dedicated to her care that his daughter came to the house one day and found him passed out on the floor, and he died quickly of blood cancer nobody knew he had. So I think for both personal and for societal reasons, it's really important to us to get it out there. And that, I think, it can feel very daunting with a new diagnosis. So it may be that you want to take it slow. You're just going to talk with your closest associates, and then together decide how are we going to share this with our wider group. But you can't really develop your care policy if you don't share the information. So I think groups like this are so positive. Having available support groups and programs is really a positive thing, because then we see reasons why it's good to share the information. We find out about the resources we didn't know were out there, and they can help us.
Awesome. So let's wrap up with you, Dr. Patel. We know that we should get, well, the females of us should get our mammograms in our 40s. Colonoscopies are recommended late 40s, early 50s. Regular progression, we do vision screening annually, hearing tests regularly. What's the protocol on a brain test?
Yeah, so per Medicare guidelines, starting at the age of 65, your primary care doctor should be doing an annual assessment of your memory. And unfortunately, I don't think that's being followed 100% of the time. So that's the bare minimum. And it's a fairly short memory assessment, sort of like checking the box saying, yes, memory assessed. I think it's a great idea, starting at the age of 65, to have a memory assessment done annually, even if you're not symptomatic, because the idea is you want to establish a baseline, and you want to kind of see where you're starting. But the truth is, if you have a strong family history of Alzheimer's or dementia, or you're experiencing symptoms prior to then, again, very reasonable to have a memory assessment done. And when I say memory assessment, I'm specifically thinking like a comprehensive memory assessment.
Okay, where would you go? A general practitioner is probably not going to do that?
Correct, yeah, and I just think that's just down to bandwidth and resources. And so we do that at Conquest Research. So the idea is you come on site. We're going to want to explore what exactly is going on with your memory in terms of what symptoms you're seeing or your loved one might be seeing. We're definitely going to want to do a deep dive on medical history and medications, because those can certainly impact memory function and have some impact there. And then we're going to administer a series of cognitive assessments. So think of those as like standardized tests that are designed to measure memory. And the purpose of that is because then you can start to use that information to just decide, is there evidence of impairment? Is it just a little bit? Is it subtle? Is it fairly profound? And that starts to drive like what next step might be. So, and I think that's something that everyone at the age of 65 at least should do once a year. As Diane said, we have multiple research companies here in town who offer that resource, so it doesn't just have to be Conquest, although I'm hoping all of you will come to Conquest. But I just think it's the more important message is it's so important to be proactive about your memory, just like we are proactive about all the other conditions that Beth mentioned.
Awesome. Well, thank you. This information was super helpful. I learned a lot on our pre-call when we got ready for this, and I learned even more today. So, and I hope that you all did as well. Did we try and sell you anything? Okay, good. And then my question is, what are you going to do with this information? Do you know who your posse is? Right? I think we should all be charged. I might ask you when you come back next month if you've got your posse in place. Thank you for being here. You are our connection to the world. We encourage you to tell your friends about the seminar series. We would love to have you bring them back with you next time. Your feedback and comments are super important to us. That blue sheet, Nicole will be snagging them from you, so you can make sure and put your comments down on that and drop them at the desk with her when you leave. Our next seminar is August 21st, and I'm super excited because we have our first out-of-town guest coming as a panelist. Dr. Nikki Buckaloo is going to be joining us. She's coming all the way from Oklahoma. In addition to having a degree in gerontology, a master's in counseling psychology, and a doctorate in general psychology, she is also the co-founder of the Seniors Real Estate Institute and is a wealth of information. She has taught me most everything I know about dealing with seniors, especially as it relates to real estate. And we are excited that she's going to be in town and is going to be on our panel, so you won't want to miss that. You can go ahead and get signed up if you would like. We always like to leave you with a quote, and this quote comes from Teepa Snow, who is one of the foremost speakers on dementia. She's an occupational therapist, and she says, "Those with dementia may have a brain that works differently than ours, but if we link our hands together, we can overcome anything." And so that gives us all great encouragement. I hope you all have a wonderful day. We look forward to seeing you next month. Take good care.